24 family, what is going on? I hope you guys are crushing it. I hope you're doing well. Hope you are having fun doing whatever you are doing today. But today we're going to be making a video talking about back pain and talking about the most common reason why back pain occurs in the clients that I work with. So if we have not met yet, my name is Levi. I started a gym in Tampa, Florida called Perform24 in 2014. That's what I do for my everyday job. And then I make YouTube videos in my garage with my internet friends when I have topics like this to discuss. So if you guys like this video, please let me know. This is a little bit different than the videos that I typically do. So if you guys like kind of these educational like walkthrough videos, please give it a like. Give me a thumbs up, send me a comment, something just to let me know to make some more of these. So the back pain that we're gonna be talking about today is like the chronic type of back pain, okay? Where, you know, like it's always just kind of there, it's always kind of nagging you, rather than like an injury back pain. So injury back pain is kind of in its own different bucket, its own different category of pain. Like if there's some type of drastic impact or intense accident or something like that, that is not going to necessarily apply to what we're talking about today. But just like the chronic, like you start to notice like, oh man, my back is like a lot more sore than it usually is. It's a little weaker than I feel like it normally is. That's the kind of stuff that we're talking about today, okay? So I'm gonna give you a concept here, and then you can apply this concept in your training certainly, but then also just in your every single day life, okay? So we're gonna actually jump to the whiteboard. I work really well on whiteboards. I've got a little mini whiteboard here in the gym. So let's jump to the whiteboard and let's explain where most typical chronic back pain comes from. Okay, so what we're gonna talk about is we're gonna talk about the low-hanging fruit to a lot of typical back pain, all right? And again, like I said, this can certainly affect your training right now, but then it can also just kind of be something that you keep in the back of your mind as you go through your daily life, all right? So I'm going to teach you a concept here that will hopefully change the way that you stand and sit and handle your posture while you're living and while you're lifting, okay? Okay, so our spine, if you think about just general anatomy here, our spine sits on top of our hips, right? All right. Yes, I am extremely intelligent here. No, but for real, so our hips dictate the way that our spine kind of sits, all right? Our hips are the foundation, all right? And so if you think about your hips, if you're standing right now, you've got your, like the front of your hip bones, and then you've got your back hip bones, then you kind of have that ball and socket joint that your femur kind of sits into your hips, all right? So this is kind of like a triangle. Okay, so as you can see, I am also an accomplished artist here, all right? This is a very complex diagram of our hips, our hip socket, our knee joint, our ankle joint, and our foot, okay? So as you see here, if we have a neutral, a flat kind of hip angle, it's going to also create a neutral spine. So we've all got a natural curvature to our spine. If our hips are neutral, then the curvature of our spine has a much better chance of also being neutral. Guys, something like this. Again, very complex diagram here, very elite artistic ability. But what typically happens in like when I work with a client, we're going through an eval, and they're telling me that, you know, they've got typical, you know, they didn't have this back pain a while ago, but they're starting to notice something, you know, the low back is starting to like be sore or bite, you know, maybe they've gotten imaging and they've got a herniated disc or a bulge disc or something. Typically the reason is that over time their hips have shifted, okay, and that hip angle has changed. So instead of being a neutral kind of pelvic angle, we call this like anterior pelvic tilt, which just is a fancy way to say that like their hips have started to dive forward. Okay, so your hips kind of dump forward, which then influences the way that your body and your spine sits on top of your hips. So that looks something sort of like this. So in this example, you can see that the hips are diving forward, which this creates a compensation in your spine, okay, to try to keep your center of mass over your feet, over your hips. Your spine has to compensate a little bit, and what that does is it creates kind of a jam or kind of a pinch some point in your back. Typically it's in that low back, that lumbar spine, one place or another. Okay, so now all of a sudden your back is compensating for the angle of your hips, and you start to have back pain. The discs in between your vertebrae are not happy with that exaggerated angle that they're sitting at, okay? And that causes inflammation, and it can cause all kinds of different types of sorenesses and whatnot. But ultimately, all you need to know is that that is not good, okay? So now the question is, how do we get those hips back to neutral? Well, this can get really, really complicated, but I don't want you to think in complicated terms. I just want you to think of like just simple like leverage and like mechanics, okay? So if we've got an anterior angle here, we're trying to level this out. The best way to do that is to pull that with really strong muscles, okay? And the strongest muscle in your body is your glutes, okay? So we want to squeeze, we want these glutes to tighten up and squeeze and literally pull your entire pelvis back to a neutral position, okay? So your glutes are the strongest muscle in your body. If they are not right, if they are not doing what they're supposed to do, that's going to cause, like I said, a whole chain reaction of problems, okay? We need to make sure that your glutes are right. Another thing that we could do in this situation is that we could just make sure that your hip flexors and that your quads are loose enough, okay? So if your quads and your hip flexors can lengthen appropriately, then that's going to make the job of your glutes to pull that hip back into where it's supposed to be, all right? So we want to make sure that your quads and your hip flexors, that they are nimble enough to be lengthened just a tad, okay? Now, after you kind of get through this, there are a couple other things that you can do. Like for example, you could work on your abs a little bit more. So like, like a lot of people that have back pain, like they're always told like, hey, make sure like you're doing a lot of planks and a lot of like neutral spine exercises, which is certainly true. And again, if you think about this just kind of in a leverage standpoint, as your glutes kind of pull the back of this hip back into that neutral position, your core and your ab musculature can do the exact same thing. So your ab muscles on the front, if you've got these rib cages, they attach to your rib cage obviously. Okay, so as your core muscles, they can kind of pull the top through, okay? So if you think of like your hips as like a wine glass, like you don't want to be dumping the wine out of the front of your body. Like you want to keep that wine glass nice and neutral. Even if you're just kind of going through this on your own, if you work on tilting your pelvis and tilting your hips forward or backwards, you're going to feel like the different musculature in your body kind of working. So neutral spine typically means like your glutes are squeezed, like your glutes are tight and strong, and your abs are working together on the top side to keep your neutral pelvis, okay? So neutral pelvis typically equals neutral spine. Most people come into the gym with me in that eval and they do not have a neutral pelvis, okay? So that's like one of the first things that we'll address, and we'll address it like this. And then I guess while we're here, we can talk about the opposite effect. This one's a little less common, but there are cases where this happens as well. Usually this happens with people that sit a lot. So people that are sitting with bad posture, when you sit, like you should be sitting on a chair like right on like your hip bones. Like your hip bones should be flat on the chair. If you're kind of like tucking your hips underneath and like tucking your tailbone underneath yourself and sitting on like the top of your hips, that's not really ideal, okay? And what that can do is that can kind of create the opposite pattern, which is called like posterior pelvic tilt, right? Where the backside of your hips are lower than what they should be. And that would look something like this. And this is going to cause a problem, sure, sometimes in your lumbar spine and your low back, but also sometimes even more so in your upper back and your T-spine. Okay, so people that sit a lot, they might have like problems like a little higher up in their back, just where those pinch points happen at a little different spot. So So back to our example. So if that's your problem here, then what do you think you should do, right? So now we need to kind of be working the opposite. So we need to be stretching your abs, guys, stretching your abs. We need to be strengthening your quads a lot. So these quads need to be super strong to help pull those hips forward. And then we need to be stretching your glutes mostly like crazy. So again, your glutes are the strongest muscle in this equation. So we need to make sure that they are loose enough that they're going to release some tension on the back of that pelvis. So your glutes here need to be lengthened, they need to be loosened, and they need to allow that posterior pelvic tilt to come back to neutral here. Okay, hopefully you guys did learn something. Hopefully that's helpful and useful in your own training or your own life. Again, like this is something that you can work on as you're just going through your daily life, right? As you're sitting in a chair, as you're sitting in an office chair, as you're sitting on your couch, as you're walking around, as you're standing doing dishes, all of those things you can kind of start to work that different pelvic posture and figure out and kind of like play with the way that it affects how your back feels, okay? And then especially in the weight room, especially as you're training, really dial in on that pelvic tilt because it will make a gigantic, huge influence on the way that your body's moving and feeling. All right, that's gonna wrap up today's video. As always, train hard, live full, and I'll see you in the next video.